Hello and a very good afternoon to you. You're watching News 9 Digital. I'm Pratibha and today we're going to talk about the COVID-19 tests that are available. It has been long debated on how effective these tests are. And as Prime Minister Modi has already spoken to Karnataka Chief Minister Yediyurappa asking him to ensure that COVID spread is under control, the Karnataka government has also taken a decision regarding the same. So comparing the rapid antigen tests to the RT-PCR tests, which are considered much more effective. So after Prime Minister Narendra Modi's nudge to bring down the COVID death rate in the state, the Karnataka Chief Minister Yediyurappa held a meeting with the officials and directed the deputy commissioners and the other officials concerned to increase the RT-PCR testing instead of carrying out the rapid antigen tests. So Yediyurappa has, spoken to the officials on spot and has told them that the test should be increased in districts across Karnataka. This is something that has also been done across the country. In fact, the Union Health Ministry itself had also said that RT-PCR test should be conducted and not the rapid antigen test. And these RATs for COVID-19 are much cheaper, which is why in several places the rapid antigen tests are conducted. They're cheaper and they also deliver quicker results. But the RT-PCR tests are the ones that are more reliable, because the rapid antigen tests have the potential for false negative results. So the Union Health Ministry's move has also given a direction to all the states and union territories to mandatorily retest all symptomatic negative cases of RATs with the RT-PCR test, and saying that this is the right strategy for it. Is that what it is, and why is it so? If that's the case, why should we be having the RAT test at all? That's one of the questions being asked. To discuss more on this and to break it down further to us, to help us understand what it's all about, Dr. Chandrasekhar joins us live. Many thanks for joining us, Dr. Chandrasekhar, an immunologist. Dr. Chandrasekhar, firstly, if you could tell us, the difference between these tests and, apart from being cheaper and giving faster results, the RATs can also be extremely, it could give out false results, which is something that should be avoided. So what would you say to that?
No, see, each test that we have, either a rapid antigen test or a QT-PCR test, they are both pluses and minuses. See, for example, what we are doing, we have to understand the fundamental of the tests. See, in the rapid antigen test, what the test is going to identify is the protein product of the virus. Which is on the surface, which it sheds when it is multiplying, which is available in the mucus of the what we collect from the throat. And if it is there in good concentration, then the test becomes positive. Whereas in the RT-PCR, what we try is we amplify the DNA or the RNA of the virus. We multiply the RNA of the virus in more number and figure out, is it in a good concentration to say whether it is positive or negative. Having understood the fundamentals, now see how the test differs. See, if the patient has a virus which is rapidly multiplying, then there is a more amount of protein in the throat. When that is the case, then there is a possibility of he getting the test positive. And the advantage is these tests are quick, and you have to just put the saliva, collect it and put it on the card, and after some time, within 10-15 minutes, you get the reading whether it is yes or no. Suppose say there is a lot multiplication is not there of the virus. And if the virus is secreting less amount of proteins for any reasons, and if someone has washed the throat thoroughly for any reason before the test, so there is always a possibility we may not get adequate proteins in the test, as a result of which the test could be negative. We need to remember, out of so much of huge saliva, we collect a little bit of the volume and try to test it. That's why the test is going to be likely to be more false negative than what we work with RT-PCR. In RT-PCR, what we do is even a few pieces of RNA of the virus is present, it multiplies it into thousands of times, and they try to identify whether that virus RNA is present in the collected sample or not. So as a consequence of which, we get that to be more sensitive than the antigen test. So we need to understand this scenario. So because of that, when you are strongly suspecting that patient is likely to be infected by the virus, it is best to do both if it is available, or if you have enough time. For example, patient is symptomatically stable and you can wait for a few hours for the diagnosis to happen. At that time, you can go with RT-PCR only.
Okay.
So say patient is really sick, you need to introduce something, you have to take a decision whether to admit the patient or whether to send back the patient home. At that circumstances, you can use RAT as a screen test.
Okay.
And later confirm it with RT-PCR.
Okay.
So it's always said that RAT is not 100% sure when you say it no. But
Okay,
when it is
could
safe,
throw,
yes.
there's a very small probability. But also,
Yeah,
Doctor,
when it says
what
yes,
we're seeing,
see,
and this is something we're seeing across the country as well, is that, because deaths are increasing, especially in those cases, there's a worry that it is perhaps because of late detection of coronavirus. So then would you say that, this is something that could be avoided, because earlier the presence of coronavirus is detected, the earlier they can get treatment for it as well?
No, the problem, as I perceive as a clinician, sitting here in taking the patient's history, etc., often the patient is not approaching for the test rather than the test method.
Okay.
The patients are reluctant to go for the test because we have put so much of scare in the mind of the patient, and there is so much of formalities which follows the test. So that's where the patient is more scared to go through the test rather than the test being objectionable. So
the stigma of it.
Yeah, basically the selection of test is not just the point. What was the concern? What entire scientific body is expressing is, if you are sure or if there is a possibility of suspicion of the patient to have a coronavirus infection, don't just be done with the RAT test. Okay, for that matter, sometime we have seen in our real time practice, patient is RAT positive, that even the QT-PCR also negative. You take his chest X-ray and do a CT scan of the chest. Chest shows a full florid infection of the corona infection, where CT can clearly say that this is nothing other than a corona infection in the lung. Even there we have some 1 or 2 cases where PCR is negative. Okay, so there we have ourselves imposed on to treat that patient as corona infection. See, you need to remember that none of the tests we do can be 100% to be positive. The reason is, see, we test with a small sample. See, I take around, say, 10 microliter of the saliva collection from the throat. And in that, if by bad luck of both the testing person as well as the patient, if that virus is not at all there in that part, only in the rest of the part it is spreading. Okay, we may miss it because I will not be able to see in the naked eye that whether the virus is there or not and collect the sample from that place. Okay, we randomly pick
Doctor,
some place and collect it,
No, just, while you said that, what should be the different criteria for the RATs as well as the RT-PCR, the Union Ministry of Health has said that any negative test that has come in from the Rapid Antigen Test should be checked again by the RT-PCR. So I'm just wondering if, that turns out to be counterproductive at a time like this when we don't have enough tests.
You have to read the line clear. If you are clinically suspecting the individual to have a infection,
only
don't exclude with only RAT. See what I was telling very clearly. Patient has no symptoms. He has just contacted with 1 or 2 guys around, and you are not very sure whether he has an infection or not. He doesn't have anything to suggest an infection. At that time, probably just doing RAT is okay. See, you are sure that he is 99% or even for that matter 60 to 70% he is likely to have contracted the infection, then just don't say no with RAT test coming negative. I think that's the line. This is the fact which we use in any test. When I clinically suspect him to have, say for example, even in TB, if I suspect a person to have a TB, just sputum test coming negative, we never say that, yes, he doesn't have TB. We go further in investigating with doing PCR and doing other tests. If required, we even do a biopsy to disprove that he doesn't have tuberculosis. If I am not suspecting him to be TB, we just screen him and say, okay, you don't have a TB, and we stop there.
Okay.
You understood? That's the
All right.
logic what we are trying to apply even in this scenario.
All right. All right. Dr. Chandrasekhar, many thanks for joining us. Thanks for your time and telling us all about it. So that's what it is. The rapid antigen test, there were fears that they are spuriously quite comforting as well, because there are several false negatives that come up, extremely scary as it appears. But doctors say that there isn't much to worry about, only in the cases where they are almost absolutely sure that there is no coronavirus or the infection present. That's when they take the RATs. But in any time they feel like there is a probability of a person having coronavirus, then the RT-PCR tests are more preferred. But of course, this does throw up a few questions on whether the RATs should be taken at all. If it is throwing up false negatives, why take the chance at all? Better to take the RT-PCR test, even if it is more expensive, even if it takes a little longer. Why not take those tests and ensure that you know the numbers as they are? But of course, the debate continues on that. Even though RT-PCR is more effective, the rapid antigen test can also be handy in some situations. Well, that's all I have for you today. Thank you so much for joining me live. Let me know in the comment section as well what you thought of it. I look forward to that. Thank you for watching. Take care.